This pandemic has created huge uncertainty, none more so than for couples looking to conceive through IVF. With the majority in their 30s and early 40s, any potential delays can cause huge anxiety that time is running out. Something staff at Care Fertility in Nottingham know all too well.
A few months' delay should not drastically impact on the success of treatment. However, you have to look into their individual circumstances, their medical history, their fertility diagnosis, and based on their personal circumstances, they have to decide what they want to do. Quite a few of the private clinics are still treating NHS-funded patients, so it is up to the patients if they're very worried and they're not prepared to wait for a few months.
Fertility treatment was suspended for nearly 2 months in 2020. And there's still a long backlog of couples seeking IVF. Michelle and Adam Cunningham from Chesterfield are in their late 30s and spent much of last year struggling to access treatment. But last month they received the devastating news that Michelle had early onset menopause and they'd missed their window.
At the back of your mind, you are always in hope that there's going to be a good outcome here, there's going to be a good solution, and when you're hit with that news, it's quite difficult to digest, really. The COVID restrictions did have an impact on, appointments not being met. We did lose a lot of time, really, over what I think if we'd have been in normal circumstances, it might have been a different entity, really.
I can't actually remember the last evening where Shell's not cried, and you can imagine in lockdown when you can't take her out, to try and cheer her up or anything like that. It's just so hard to deal with.
In fact, the isolation of lockdown has seen huge numbers of couples with fertility issues seeking mental health advice. A recent survey by support group the Fertility Help Hub claims all respondents felt mentally traumatised by setbacks caused by IVF delays, and 47% feared COVID could spell the end of their parenthood chances.
63% said that they are putting themselves under financial pressure to go privately to speed up the process. And that is a huge amount of people and an unbelievable amount of stress. Some people said that they've put on hold saving up for a house because they feel that they want to pursue having a family.
And the cycle of relaxing and tightening COVID restrictions continues to impact on initial fertility investigations.
Because so many hospitals have been overwhelmed, it slowed things down. But patients were starting to be seen again by the autumn, and this current third wave has really put a stop to most secondary care work.
We should not be using COVID as an excuse, because the resources required by COVID are not the resources required by infertility patients, and we should be effectively treating them as soon as we can. We should be moving faster.
NHS England say they encourage CCGs to be flexible and sensitive for those whose investigations or planned treatment were disrupted due to COVID, ensuring those seeking fertility help are treated fairly. But for thousands of couples, the wait goes on, and for others, delays have tragically already taken some options away from them. Nick Smith, ITV News.